Sometimes patients come in specifically asking for an operation. I want a closed rhinoplasty. I want a piezo. I want this. I want that. Well, what's most important is find the best surgeon you can. All the research you do on the internet may not give you the information that applies to you. Nasal anatomy is very variable, and one person than another may have a different approach, different procedure, different techniques. What you want to find is the best surgeon to get the best results. So why open versus closed? People do only closed rhinoplasty. They call it closed scarless rhinoplasty, make it a big marketing thing. And that's what it is, marketing. I did closed rhinoplasty for many years, and I still do in about 40% of my primary patients. That means the incision's all hidden inside the nose. I do this when you have a hump, a wide tip, devious septum. The modification is fairly straightforward. And back before the mid-80s, all rhinoplasties were done closed, and most patients got really good results. So why did it change? When open rhinoplasty was introduced by Dr. Goodman in Canada, taught Dr. Anderson in the US, who then taught numerous surgeons around the country, we made an incision here. The difference is a tiny incision, 3 to 4 millimeters, that you can see the nasal anatomy. So by seeing nasal anatomy may help you make a diagnosis. And if you have a very complicated nose, such as a very projected nose or sticks out very far, a very crooked nose, or a complex revision where the anatomy is not necessarily obvious, then that's what I use as an indication for open. Some surgeons who really were afraid or didn't do very good nose jobs or didn't do very many, doing mostly other surgeries, breast and body surgery, figured, oh, if I do it open and I see the cartilages, it will make me a better surgeon. It won't. Exposure or a simple incision does not give you a better result. What gives a better result is understanding the anatomy and knowing who you need to apply it to. So again, for me, open versus closed, this incision heals to the point where someone has to be looking up your nose, be close enough to actually count your nose hairs to see it. The healing is the same, the complication rate is the same, the discomfort, the black and blue after, exactly the same. But if I want to see more because I'm concerned about some unusual anatomy or making a lot more maneuvers, placing in a lot more grafts, I may choose open. That does not change the result I'm going to get. And you want to find the best surgeon you can. Look at their before and afters. It's not a matter of quizzing them on what techniques they use. It's finding out whose aesthetics matches yours, whose techniques may create results that may look the best on you, and let your surgeon choose. Because, as I say, don't let your Google research confuse yourself with their medical degree.